Nervous System 5. Cognition, learning, memory, executive functions, behavioral control, and perception, as well as regulation of emotions, are the highest order functions of the nervous system. Sensory and motor functions, intelligence, and memory of knowledge, as well as skills, are generally preserved in individuals with PFC damage. Impairments are found in the appropriate social engagement of planning and decision-making ability. These lesions also result in emotional blunting, personality changes, and the reduced ability to think in abstract terms. The central neurotransmitters initiating the stress response include norepinephrine from the locus cerebralis and corticotropin-releasing hormone. Stress system activation increases heart rate and blood pressure, releases cortisol, and suppresses systems like growth, GI function, and sexual function. The acute stress response, the preparation for fight or flight in the sympathetic nervous system, the switch from calm and thoughtful responses to reflexive and sometimes self-destructive habits of thought and behavior, perpetuates patterns that are more useful in the short term, not in the long term. When stress becomes chronic, there are pathophysiological changes such as psychological dysfunction accompanied by abnormalities of metabolism, cardiovascular impairment, decreased immunity, and various alterations. Chronic stress is associated with elevated cortisol levels that can lead to structural and functional changes, and the changes may contribute to the known effect of stress in precipitating or exacerbating depression, anxiety, and addiction. Stress-induced changes in brain neurochemistry and function can increase risks for development or exacerbation of depression, anxiety, and/or substance use disorders. Major depressive disorder is the most common in women and young adults aged 18 to 29 years old. There is a long latency between beginning an antidepressant treatment and achieving an improvement in the mood, roughly 4 to 6 weeks. Antidepressant drugs that have clinical efficacy and are more selective in their action with decreased side effects include SSRIs, norepinephrine reuptake inhibitors, and SNRIs, or serotonin norepinephrine reuptake inhibitors. Over repeated exposures, cortisol elevations damage the hippocampus and its regulatory functions. Cortisol consequences of hippocampal damage decrease emotion regulation and contribute to depressive symptoms. There are a variety of anxiety disorders that include generalized anxiety, panic disorder, specific phobias, social anxiety, to name a few. The features of anxiety disorders include responses to threat or perceived threat that have a strength, intensity, or a duration greater than would normally be considered with an objective assessment of the same level of threat. Anxiety can be associated with increased hypertension, diabetes, cardiovascular disease, irritable bowel syndrome, tension headaches. Cognitive behavioral therapy is the main therapy for anxiety disorders and can be effective at reducing fearful attributions to ambiguous stimuli, increasing their coping, and decreasing automatic activation. Medically and pharmacologically, there are many SSRI and SNRI antidepressants that are effective for acute and anxiety and panic attacks. These are often treated with benzodiazepine medications, but there is abuse potential if used chronically. Chemical substances associated with substance abuse disorder can include alcohol, nicotine, cannabis, opioids, sedatives, stimulants, and various other substances. The use of these substances is associated with reinforcing properties or a positive effect that reinforces the desire to repeat the action. Many substance abuse disorders are often comorbid with both depression and anxiety and may be related to self-medication efforts to cope with the various conditions. SMA is characterized by the progressive, complete inability to have motor function due to the death of spinal motor neurons. So it presents as a lower motor neuron lesion. A seizure is an episode of observable signs and symptoms secondary to synchronized abnormal activation of a large number of cortical neurons. Seizures can be manifested by sustained muscle contractions or a tonic phase, by alternating contraction and relaxation, the clonic phase, or they can have a different presentation. Some seizures can be focal with manifestations that reflect the brain region of origin, but others may be generalized. The main causes of neonatal seizures are hypoxic ischemic encephalopathy that can occur as a complication of labor and delivery. Epilepsy is a condition that predisposes one to recurrent seizures and may be associated with a constellation of cognitive, social, and psychological consequences. Brain tissue itself does not contain nociceptors. Stimulation of other structures within the head that do contain nociceptors can often cause headaches. These various structures may include the venous sinus, meninges and meningeal arteries, sinuses, periosteum of the skull, subcutaneous tissues of the head, muscles of head and neck, the eyes, and the ears. Cranial and spinal nerves that relay a pain sensation from the structures of the head and neck will include the trigeminal, cranial nerve 5, glossoapharyngeal, cranial nerve 9, the vagus cranial nerve 10, and the upper cervical nerves, which are C2 and C3. Most common headaches are migraine and tension type headaches. Headache warning signs. Timing is a new dramatic onset that occurs upon awakening or causes an individual to awaken. The location is limited to an area with marked increase in frequency or severity. The context or position worsens when the individual is lying. Severity, they state it's the worst headache ever and it's like a thunderclap. Various associated symptoms are uncontrolled vomiting, personal or behavioral changes, altered mental status. Upon physical examination, there may be an abnormal eye exam with abnormal eye movements, diplopia, or papilledema. There may be an abnormal neurologic exam with imbalance, ataxia, seizure, unilateral weakness or numbness, focal, motor, or sensory abnormalities. A concussion is a mild traumatic brain injury with a complex pathophysiology that has not been fully understood. Concussion is common in children and adolescents, especially those that are involved in sports. These are various structural changes that occur with gerontology, as well as brain changes that are associated with an increase in age. In an acute confusional state that is known as delirium, the individual experiences a rapid onset of altered lucidity with fluctuating symptoms of confusion, agitation, delusions, inattention, distraction, perseveration, and poor concentration. Alzheimer's disease 1. Alzheimer's individuals have been viewed post-mortem, and the following pathological examinations of the cerebral cortex have identified two consistent abnormalities. The first is the buildup of beta amyloid protein, known as plaques, between the neurons. And the second is the presence of tau protein within the axons, known as tangles. Strokes can be either ischemic from thrombus or embolus, or hemorrhagic based on their pathophysiology. The internal carotid arteries give rise to the anterior cerebral and middle cerebral arteries, which supply the frontal lobes and some of the parietal lobes. The vertebral basilar arteries supply the brainstem and cerebellum and give rise to the posterior cerebral arteries, which then supply the occipital lobe and portions of the temporal lobe.
Let's talk windows. R5 window material, but you got to stop and try to shove open that